Okay, good afternoon, everyone. This is Andy Reese, the director of DDS. Um, as always, I will start by sharing our data, which once again, fortunately, is not very different from last week. So we are still at 446 people who have tested positive for COVID-19 since the beginning of the pandemic. 2 people tested positive in October. By placement type, 9 of these were in host homes, 114 in intermediate care facilities, 1 in a mental health facility, 62 in natural homes, 2 in nursing homes, 4 in out-of-state placements, 41 in residential habilitation, and 213 in supported living. So by placement type, what that works out to is about 38% of people in intermediate care facilities have contracted COVID. Out of those 114 people, we have had 28 people who have died. However, 13 of those have been confirmed COVID deaths, reflecting about 11.4% of people in ICFs who contracted COVID and have a confirmed COVID death. In natural homes, the 62 people with COVID reflect about just under 7% of people in natural homes who have contracted COVID. Of those, we have had 6 deaths. 5 of those are confirmed COVID deaths, representing just a little over 8% of people in natural homes who contracted COVID, who have had a confirmed COVID death. In residential habilitation, it's also about 38% of people in residential habilitation who have contracted COVID. Of those, we have had 3 deaths, 2 of which are confirmed COVID deaths, representing about 5% of people in residential habilitation who contracted COVID and have a confirmed COVID death. In supported living, the 213 people represent about 22% of people in supported living. Among those, we have had 24 deaths, but only 15 are confirmed COVID deaths, representing about 7% of people in supported living who contracted COVID and have a confirmed COVID death. So overall in DDA, about 18% of people supported by DDA have contracted COVID. Since the epidemic began, of the people who have had COVID and have subsequently died, we've had 64 people. Of those, however, only 37 are confirmed COVID deaths, representing about 8.3% of people supported by DDA who contracted COVID and have a confirmed COVID death. So by placement type, the 2 people who contracted COVID in October, one was in a natural home and one was in supported living. And none of the people in October who contracted COVID have required inpatient treatment for COVID. In fact, we have had no one who has required inpatient treatment for COVID since April of 2021. We have had a total of 64 deaths of people who have contracted COVID. 16 of those, however, have been confirmed as not COVID related. For 11, we are awaiting confirmation from OCME regarding cause of death. I will note the one September was not reported. September went up this week, not October. We had a person in a natural home where the parents provided us the information last week about their child dying a couple of weeks prior. And so of COVID-related deaths, confirmed COVID deaths, we've had no confirmed COVID deaths since March, at which time there were 2 confirmed COVID deaths. We had 1 additional provider staff person test positive this week. So over time, we've had 740 provider staff who have tested positive. Of these, 52 have been reported by more than 1 provider, and we have had 10 staff deaths from COVID. Our vaccination rate among people supported by DDA overall, it's 80% have been at least partially vaccinated. Within host homes, it's at 86%. In ICFs, it is 99%. In natural homes, it's 63%. In residential habilitation, 98%. And in supported living, it is 89%. Among our provider staff, the most recent documentation that we have, or the most recent reports we have from providers, are that 80% of provider staff are fully vaccinated. And amongst DDS staff, the most recent report is that 93% are fully vaccinated. So I just wanted to provide an update for people. We have worked out with DHCF because, as people pointed out last week, there are a large number of folks who had some kind of day service on their ISP that has since been removed from the ISP. And so doing amendments to all of those ISPs in order to process the retainer payments seemed excessive. And so we've coordinated with DHCF. And what we've confirmed is for providers who, and we will be sending out a transmittal that explains all this to the providers this afternoon. So for providers who were providing services, day services to people pre-pandemic, who are no longer able to provide the service because of the pandemic, they can submit. We don't need for there to be the service on the current ISP. We've worked that through with DHCF. They can submit. The procedure codes are the procedure codes that have been used previously, so those should be available to you. And this would be just so people may have noticed that DHCF posted updated procedure codes and rates July 1, 2021. What we noticed as we were rolling this out is that some of those rates we wanted to confirm, and therefore any retainer payments that people are seeking beyond June 30, 2021, we're going to ask you not to submit a claim for those for another week or 2 while we confirm what the proper rate is, so that we don't have issues with making payments that are an improper rate, because resolving that is quite time consuming on both ends. However, everyone can submit claims for retainer payments for those services that are eligible. You may want to go back and read the, which is also, I believe, attached to this document. Yes, there is the guidance that was the frequently asked questions that was drafted last summer. We will send that out along with this guidance. So for retainer payments from January 1, 2021 through June 30, 2021, you can go ahead and submit those claims. Keep in mind that for any claim, you also do have to complete the attestation, and we will be reaching out to providers to make sure that we have a copy of that attestation on file at DDS in the event there's any follow-up in the future from CMS and any audits, because the attestation is required, and the required language of the attestation you will find in in the attestation. It is the same as the prior attestation. If there are questions about rates or billing, you can email those to dds.covid19billing@dc.gov. And Pam Harmon is also on the line with us, so that if people have questions, specific questions about billing for those retainer payments, she should be able to respond to more specific questions about that. However, just to reiterate, the retainer payments could be retroactive to January 1, and so, and keeping in mind, a retainer payment is available if you were authorized for a service and unable to provide that service because of COVID, and the person is not receiving a day service somewhere else. So if you were authorized pre-pandemic and they are now with another provider, that claim would be rejected because the person is getting the service elsewhere. But from January through June, um, you can bill for 90 days of retainer. And those 90 days of service get you up to somewhere in May if you're doing it 5 days a week. For people where you might have been able to do 1 or 2 days a week, you can bill for the other days. Just don't submit claims that go beyond June 30th just yet. But at the very least, you can submit claims for the first 6 months of this calendar year. And I hope any of that clarification didn't further confuse it. If anyone has questions, as always, you can type them in the chat and just send them to make sure you address them to everyone. When will the guidance for ARPA funds for vaccine incentives be sent out? That's a good question. So I was reading. We have our ARPA update was being put together, and so I was trying to remember what that said. What will be sent out is a request for applications, and um, and so I'll have to check with DHCF about where we are with sending that out. Um, because what they will do is send out or publish a request for applications, I think it's called, and that would be where you would describe how you would spend those funds, and then it would subsequently be funded. The email address, can we repeat? And if someone from the panel has more of an update than that regarding the ARPA funds for the vaccine incentive, please provide that. The email to send your retainer payment questions to is
Director Reese, I posted it in the chat box.
So for people who may be on the telephone, that is dds.covid19billing@dc.gov. Just to be clear, we are able to bill retainer payment for the period January 2021 to June, it doesn't say it, but to June 30, 2021, as long as the person is not in another day program. How would we know if the person has enrolled in another day program and when? I mean, you would need to check with either the person or the service coordinator if you have questions about that. I know some providers have been staying closely in touch with people for whom they provided day services. Um, and so, check in with the person's team about where they are with their services. Um, um, I received a response from DC Health regarding a medical exemption for a DSP. It was rejected because the specific component of the vaccine that the DSP was allergic to was not included in the original attestation evidence provided by her primary care physician. The letter states that the medical exemption will be denied if there is not a response within 5 business days. Can a new request be submitted if the primary care provider cannot provide further evidence in time? So we don't have, I um, don't know that we have anyone who can answer questions about their portal. But if their response was, this is denied unless we have something within 5 days, then the answer is it was denied. And I guess I'm not really clear about what another request would look like.
It seems as though what uh, the respondent is saying is that the request didn't have the specific component of the vaccine that the person was allergic to documented in the request for exemption, and therefore it was denied. And it seems as though DC Health was giving them 5 days to get a appropriate documentation, or it will be a final denial. That's what it seems like it reads. But I'm just speculating based on what's included in the response.
Well, I get that, but I don't understand the question. Can a new request be submitted if the primary care physician cannot provide further evidence in time?
Well, that part doesn't really make a lot of sense either, because if it wasn't all inclusive, the primary care physician cannot provide it, then it, as you state, would be denied. I don't think they're going to extend this thing out further. But I am speculating for DC Health. I would just say whoever has this concern probably should reach out to them directly, because we didn't plan on having them on the call today. They were on the call, what was that, last week, to answer
Two
these
weeks ago.
questions? Well, 2 weeks ago, I'm sorry.
Some staff reported that they are unable to renew their TME license because the computer is displaying date of birth not matching up with the TME license number, even though all of the information is correct. Please advise. Didn't they ask people to email questions, Winslow?
They did, and they asked questions specific to TME to go to Miss Melody Franklin. I'll try to post her email in the chat box. The supervisor of the team that processes those TME requests, Miss Melody Franklin. So to pull her email up. I'll put it in chat once I find it.
Are there potential offsets for additional retainer day billings if agencies received PPP loan forgiveness, HRSA, PRF, or any other federal assistance, as was the case in the initial go-round of day retainer billing? All of the guardrails that were in place for the retainer payments the first time are in place this time. And as I said, the transmittal that you will receive today has frequently asked questions from CMS that will spell all of those kinds of questions out.
Director Reese, could you explain what a guardrail is?
It's about ensuring that the payments are going for what they are intended. It keeps you within the rules of the retainer payment, like a guardrail keeps you on the road.
Thank you.
At an earlier session, you discussed an upcoming study related to people who died during the pandemic. What is the status of that study? It's part of our ARPA plan. And so your plan gets approved and then you have to be approved for the funding. And so we should be seeing the solicitation for that study going out relatively soon. Can we explain the billing regarding virtual day supports if offered? Is it a different modifier and procedure code? How many hours can you bill? And actually, Pam, can you respond to the question of whether there's a separate procedure code for virtual day services?
Hi, there is no separate code for billing of the day remotely. Waiver only issues authorizations for remote services for in-home supports, supported living, periodic with or without transportation.
And so they would just bill using the regular procedure code, and the authorization would be the hours authorized by the team.
That is correct.
And so the team would discuss what an appropriate number of hours of service would be. Regarding retainer payments, wouldn't it be if someone is now receiving a day service as of 10/22, but was not receiving day services beginning 1/1/21, the provider could seek a retainer. The fact that the person supported might now be receiving day is not a disqualifier for back on 1/21. He's saying Benita Jenkins was the TME lead contact, Winslow. So, yes, the issue is, okay, retainer payments were authorized retroactive to January 1. The only issue is if you submit retainer claims, you're submitting them for days of service or hours of service that would have been paid, that would have been provided were it not for the pandemic. So on January 1, if pre-pandemic you had been providing dayhab to a person and now you aren't because they're not coming because of the pandemic, you could submit a claim for that day for dayhab. However, if that person is on January 1 was participating in day services somewhere else, then obviously that person was not unable to attend day services because of the pandemic because they went somewhere else. So that's the issue of if they are going to day services. So if 5 days were authorized pre-pandemic and now they're not able to go, then you can bill for the 5 days, assuming that they're not getting that service elsewhere. And that would be true for each of the days for which you would be submitting the claim. Please provide a status of self-direction in DC. Self-direction was having biweekly meetings at one point. Are they still happening? Can you provide that update, Kirk? I know that it's an issue of right now, so that was another thing that is part of our ARPA plan, and it requires a waiver amendment.
Correct, Director Reese. So we're looking at sometime in calendar year 2022 for the start of the program. We have to go through the process of amending the IFS waiver, which is not a short process. And so we're hoping that sometime in calendar year quarter 2, the program will start the meetings to resume or to initiate self-direction.
Someone else also indicated that their recollection was speak to Dr. Jenkins regarding TME renewal issues. Winslow has posted Dr. Jenkins' information in the chat for those of you who are on the phone. Her email address is bonita.jenkins@dc.gov. A question, what if the person remains at their residence receiving companion instead of day service? Then you're absolutely fine. So most of you, I expect, submitted claims for retainer payments a year ago. It works exactly the same. And, the fact is people were at home getting companion services because they couldn't go out and get day services. But if they are receiving any other day service during that time, then you could not be billing for those days that they're getting that service. And think about, for example, a person maybe was getting day-hab and had their CPAC meeting, and everyone agreed that now they're going to get IDS. On those days, that's a day service. You can't then get retainer payment for the days you would have been paid on the days they are getting IDS. But our companion service was done as sort of a patch because people needed to get some kind of support during the day when they could not get to a day service. So we don't seem to have any other questions today. If that's the case, we'll just give you a couple minutes because there's always people who as we say, well, if there's no questions, we'll go. They think of something. So we'll give a couple minutes for people to think of those questions they have last minute, and otherwise we will talk with everyone next week. Someone is asking again for the email for Ms. Jenkins. It is in the chat, but I'll put it at this place in the chat as well. It is again, bonita.jenkins@dc.gov. Okay, well, have a great weekend, everyone, and we will talk again next week.